Hey guys, what's up? Welcome back to this YouTube channel. It's your guy Igor here. Guys, today's video is dedicated to healthcare in Canada, and it's actually a huge problem here in Canada. For those of you who are living here, I just want to share with you and get some of your feedback on what do you think I should do. And those of you who are not in Canada, you're going to be surprised on how the healthcare is here in Canada. So I want to share with you on that video. And also this video was inspired by one of the comments on the childcare problem in Canada video that I just made yesterday, that I published. So I wanted to provide some feedback, guys. Here is the thing about Canadian healthcare, and I want to share with you. Well, first of all, it is not free, as some of you are thinking, because there is a different kinds of payment. You're paying for something is free by your time being wasted. Okay, and the taxes that you're actually paying. No, it's kind of free, guys. So it's kind of free-ish. But it's not really free because we are still paying for it. Okay, guys, here is how healthcare works in Canada. Let's say right now, you have some throat, maybe even some cough. All of a sudden, you're like, well, what should I do? You don't feel good. You have some you have to deal with that disease or something, whatever. You have to go to a doctor. So, in the past, it's been terrible. In the present, it's even worse. So here's the situation, guys. Well, you got something. You don't feel right. Now, if you look at the government's website on the COVID symptoms, almost anything is a COVID symptom now. So you're like, oh, I need to see a doctor. You call in and they're like, do you have any COVID symptoms? And you're like, well, I'm coughing a little bit. They're like, whoa, red flag, that's a COVID symptom. So what it means is that get tested for COVID before coming there. So the doctors here, they're kind of, especially with the new variants, they're kind of chicken out, and they're like, well, we don't want you. I'm going to be paid far too much to get sick. I want to be safe because I'm a doctor. And this kind of thing. So, first of all, they're going to try to shoo you away so that you don't go there just in case you're sick with COVID, with coronavirus. So, that's one thing. Now, once that out of the way, you went, you got tested, it's negative. Now you can go to see a doctor. You see a doctor, and you're like, wow, now what? I'm going to get some good treatment. And they're saying, well, take some Tylenol and shut up. So it took you a few days, okay? First of all, you wanted to go there. Now you got tested. Then you went to a clinic. And a clinic is going to be like if you don't have a family doctor. And honestly, guys, I have a family doctor. But he sucks. Okay, that just sucks. I don't like him. I like him as my family doctor. And because he's money-minded. And, well, I still can't find a good family doctor here in Canada. And people who I like, they don't take any new patients. So, it's a problem to find a family doctor here in Canada. My family doctor doesn't want to spend enough time with me as a patient if I go there. So, for how the regular visit to a doctor here in Canada is going to be, well, let's say you don't have a family doctor. You go through a walk-in clinic. The entire process can take you like 40 minutes. So you go in, you check in, you fill out the questionnaire, you give away your health card, your ID, and things like that. And then they're saying, well, now you can see a doctor. Good, now you have to wait. You wait for 40 minutes, 45 minutes. And finally, they take you into a room size of a cube that is 5 by 5 feet wide, and a chair, like a isolation chamber, or I don't know, like a cubicle. If you're claustrophobic, you're not going to like it. So you sit there for the next 15 minutes. So now you're 1 hour into it. And then the doctor comes in and says, looks at the computer. And the doctor is also late by another 15 minutes. But the doctors are not late because they're busy. Okay, and so the doctor comes in and asks, so how do you feel? And you tell them how you feel. Then the doctor is going to ask you, so what do you think it is? Then you start answering that question. After that, the doctor is going to laugh at you and they're going to say, no, that's not what it is, and blah blah blah, and they're going to spend about 30 seconds more. In about 2 minutes, the doctor is already looking at the door trying to escape, because they have to shake hands with more clients. So they have a bunch of clients, not so many doctors, and they literally get paid for handshakes. So they charge your health card, next, business, money. And on top of it, I find doctors here are arrogant. Either that's because of the responsibility that they have towards the patients, or irresponsibility, or maybe something connected to the people here who are telling them that they are some kind of supreme beings from another planet that know everything better than you or me. That's one thing. I find Canadian doctors are arrogant. They don't, they are behaving in such a way that their time matters and yours don't. And it, quite frankly, pisses me off each time. So that's like a small snapshot of the healthcare system here. Doctors don't want to spend time, they don't want to explain to you a lot of things because they have to keep on going. And you can see how agitated they get once you start asking more questions. Hey doctor, what do you think? Should I be doing this or should I be doing that? And they are unwillingly, most of the times unwillingly, answering to your inquiries. So, it doesn't feel here in Canada like doctors, they really care for their job or for you or as a patient. And it feels like they are there to charge the healthcare insurance, to get paid. They treat you as if you don't know anything, and they treat themselves as if they know everything and their time is valuable, but you're just wasting their time because they could have been making more money with another patient. That's how it feels in a healthcare. In my opinion, a lot of doctors here in Alberta, where I'm from, are not fit to be a doctor. They're not fit. They don't have the skills. Maybe education. But how about customer service skills? How about those essential human skills that a doctor you would expect to have? And that's kind of a feeling that you get here in Canada. So you literally spend 2 days worrying about something. You go in there, and then they'll prescribe you some either severely mild medication that might not even know what's actually happening with you, and they'll say, well, take some Tylenol, see how it goes. If that doesn't help, you come back to me, and then we'll prescribe you something else. We'll look on how the situation develops. So that's kind of the snapshot of a regular person. Now, if you need a surgery, if you are sick, good thing in Canada, they're not going to let you die. So you're not going to be dead. The healthcare here is alright in that sense. But in terms of emergency, heard people breaking their arm, sit in the emergency room for hours, literally the entire night, because they also service people in priority manner. So people who are more likely than others to die go in first, and people who are, in pain, you're not dying, right? So you can wait. And that's kind of the reality, guys. And in terms of surgeries and everything, the wait times can be crazy. Now it's going to be getting done eventually, but you have to wait for so long, and it can take months for you to suffer until something gets done. So in terms of people who are saying, hey Igor, the medicine here is free, well, you pay by suffering, waiting, and paying their wages, taxes, and being disrespected by medical professionals. That's what medical situation here in Canada is. Now, of course, the technologies, the education, and there are some good doctors too. There are really good doctors, and I've seen really good doctors here in Canada. But it's so rare to find. I don't know why it is so difficult to be a good doctor. A person who is knowledgeable and able to provide service care and what they're actually expected to do. And unfortunately, guys, a lot of people would disagree with me on this video here in Canada. Maybe it's because people were born and raised in this kind of system, and for them, for people who are here, it's like, that's okay. Maybe it used to be worse, maybe it's better now. I don't know. You guys tell me in the comments down below if you find a lot of things. I mean, I don't like complaining too much, but you know, medicine here in Canada, healthcare, I'm not going to say it's good if it's not good. That's what I'm trying to say. Saying things have to be changed, attitudes need to be changed. You know, those guys get paid so much of money, $300, $400, $600,000. That's crazy in a year. Of course, they are not regular mortals, more like politicians who are severely overpaid, in my opinion. See you guys in the next video. Bye for now.